Molly's here with us today from the Texas Council on Family Violence. Molly is going to talk. Well, Molly is going to talk to you. I'm going to bring up her PowerPoint presentation, and here you go, Molly.
Thank you so much. I have to say, we were so excited to be here to talk to this audience. You know, all the hard work we do every day, and I have to share that as in high school and in college, I did different internships with school health officers, so I know firsthand how hard all this work is. I should be joined in a little bit by another coworker. I think she's on her way here, so we may interrupt when she comes in. But I'll go ahead and start. I think the first slide will be a picture of her, so you can see her before you get to see her. So I always like to first kind of give an introduction of myself. My name is Molly Voiles. I have been working at the Texas Council on Family Violence for over 6 years now. There's my coworker who will come. You want to go to the next slide? Oh. There's always. Okay. They're helping me out with technology. Thank y'all for bearing with me. Thank you guys. Okay. There we go. No picture, but you can see the visual. Great. Again, my name is Molly Voiles. I've been with the Texas Council on Family Violence for about 6 years now. Prior to that, I worked in a shelter here in Austin for a number of years, and then prior to that, I worked in a shelter daycare for a number of years. So I have spent much of my life working in the field of family violence, working with survivors and their children. I think that prior to that, I do come from a social work background. As I said before, I've had the privilege of working in schools. I've had the privilege of working with health in that arena. And so coming to this work, I really did see the connection between the way that health, and particularly the health of youth and adolescent around violence, around those risk factors, is critical to discuss. So I think that's why we feel so privileged to be here today with this audience. I'll tell you a little bit more about where I work. Again, I work at the Texas Council on Family Violence. We are a statewide nonprofit representing all of the member programs in Texas. So there are over 100 family violence programs in Texas currently, and we have over 900 members, individual groups, folks across the state who believe in the work on family violence. We are also privileged to operate the National Domestic Violence Hotline, which y'all may have heard of. We're also privileged to operate Love is Respect, which is the National Dating Abuse Hotline. We'll talk a little bit about later because it can be such a great resource for folks. I come from a policy background. I do work on the policy team at the Texas Council on Family Violence. So I'll be speaking a lot about how Texas has responded via policy and legislation to the issue of teen dating violence and dating abuse. And we're going to be spending most of our time here on this agenda. We're going to have other fabulous speakers talking about the connection between dating abuse and our schools and the way it affects teens and even younger. But I am on a policy team, so I do like the analysis level. So I want to make sure y'all know the overview of what we're going to be talking about today. We really want to highlight that it's preventable, specifically for the work y'all do. You are often working with youth before this begins to come up, or when you start to see kind of red flags around it. So the first thing we're going to do is talk about Texas's policy response to teen dating violence. We want to talk about awareness and prevention education, and we also want to offer some resources to establish a relationship with your local family violence program because we do know how much work y'all do every day. And so we want to be able to point out some resources in your community that can be able to help out. You'll have to forgive me, I need to keep my eyes on it. Okay, thank you. The first thing we wanted to do is just give an overview. What is teen dating violence? And I think a lot of us, we know about it. We see it in the media. I think we've all heard quite a bit about Chris Brown and Rihanna. We see these images. We see this information in our media around the way that you interact. But we really want to focus because this is kind of a part of our overall program on coordinated school health. We wanted to focus on the CDC's definition, and they define it as physical, sexual, or psychological or emotional violence within a dating relationship, as well as stalking. And I think that part is something we do feel familiar with somewhat, but one of the other things we want to highlight is that nowadays, especially with youth, probably received that in my entirety of my cell phone service. But for teens, that is how they're communicating. So a lot of times when you're starting to see teen dating violence, it can be, hey, where are you right now? What's going on? So you really want to highlight that. We also want to talk about teen dating violence and the school health, coordinated school health model. And like I said, I know y'all are here today talking about that, but we really want to think through these areas. These are some goals that y'all are very, very well familiar with. I know Texas has its own coordinated school health model, but these are from the CDC. And these are the 4 overriding goals that lead to that. And I want to kind of think through each one and how it might relate to teen dating violence. The first one, the increasing health knowledge, attitudes, and skills, it seems that the school setting is a prime time to start talking about what does a healthy relationship look like? What are those pieces that come together to paint that picture for you? Because those attitudes, those knowledge, and also the attitude that this is not okay. We need to strike a balance between saying that teen dating abuse and dating abuse in general is not okay, but also creating an atmosphere where teens can move forward. Increasing positive health behaviors and health outcomes. I think there are numerous ways that y'all as educators, and even in your day-to-day interactions, even outside of any curricular development or anything like that, have the ability to do that. First, obviously, any school health programs y'all have are designed to avoid risk behavior. So it may range from bullying, it could be alcohol awareness, but another could be how we interact within relationships with each other. And I know y'all do a lot of that work, but I think it's so important just setting the framework that this is not okay. We're going to talk later about how those kind of programs, that information, can lead to improved education outcomes and social outcomes. Because we do know that teen dating violence can have a marker for how it affects the overall life of the youth. We also know that it's important to know the stats. It's one thing to begin discussing how this affects, but let's really think through these statistics. The first, and this one always stands out to me, is that 1 in 3 students report experiencing some form of abuse. That's 1 in 3. That's a huge number if you think about it. At your table or in your office, 1 in 3. A quarter of all high school girls have been victims of physical or sexual abuse. 22.4, so we've got roughly 1/4 of adult female victims and 15% of adult male victims first experience some form of partner violence between 11 and 17. And what is 11 and 17? That's the exact window in which educators and school health professionals are working with. Lastly, we also know that in a recent study, 75% of 7th grade students were already dating. I think it's hard, but we do know that at that age, you're starting to think about this. And 37%, so again, we're back to that 1/3 statistic, reported being a victim of psychological violence. Before we move on, I want to make sure that I introduce my coworker who's going to be presenting with me today. I think if you touch your mic, you'll be able to introduce yourself, and we'll go back to your slide and then you can just introduce yourself.
Thank you, Molly. I'm Gabrielle Young, and I'm a prevention coordinator. And the prevention department, am I on? Great.
Yeah.
Okay, thank you. The prevention department works with schools and educators around the state to both support the work that we're doing and to work with domestic violence shelters programs to go into schools and communities to activate those violence themselves. So that's what I do. Thank you, Molly.
Yeah, thank you. So we'll flip all the way back through. I wanted to make sure that y'all had a chance because I know you're seeing both of us. And I think we just talked about those statistics, and we really do want to highlight those not to cause fear, but to really say this is happening. And it's happening way more than we think, partly because we also know sometimes we see stats that up to 1/3 of youth do not reach out, do not say, hey, I'd like to talk to you about something. So we really want to highlight that unfortunately and sadly, this is very widespread.
Thank you. So Molly, have you already been through the policy response?
No, we haven't. We actually are right where we should be. You're able to
Okay.
slide right in.
Wonderful. So we are not going to be asking the polls.
Nope, those have been removed.
Right.
Yeah.
Okay. So sorry, you guys, I
The
just
joy
got
of
here a little bit. The
webinars.
joy of webinars. So we're right where we're going, and we're going
Mhm.
into my presentation right now. Yes?
Well, actually, no. First, what we really want to do is focus on kind of some of the markers with dating violence, health, and school. And I think you were going to talk maybe a little bit about what is we talked. So there's stats. We laid that out. Well, what does that mean, and what does that mean for the student? We talked a little bit on the health, that there were some markers that would come in later.
Okay. Thank you so much. I apologize, everyone. So when we think about dating violence and we think about the whole spectrum of adolescent risk behaviors, we're looking at obviously substance abuse, alcohol use, risky sexual behavior, self-harm, and potentially being at a greater risk for becoming pregnant. I know that health workers are concerned with all of these risk behaviors, and there are a variety of different entrance points to approach them individually. But when we actually look at the whole spectrum of them, we find that relationships are at the heart of all of these risk behaviors. And if a student is engaging in any one of these, we want to ask about the quality of their relationships. The relationship itself can be the nexus and the central point from which all these other risk behaviors stem. So teen dating violence victims are much more likely to do poorly in school, they have lower graduation rates, lower rates of academic achievement, and lower performance on standardized test scores. Obviously, if you're stressed, and you might be afraid to go to school because you might be afraid to see someone who's victimizing you, you'll be less able to concentrate in school. There are mental health effects, obviously. Trauma is experienced by dating violence victims, and that can lead them to become depressed, anxious, or have post-traumatic stress disorder. It's difficult when you're in a dating violence, if a student is in a dating violence relationship, to really control the boundaries of sexual behavior and to establish limits with someone who may be victimizing her. So we see that there is a higher risk of pregnancy and contracting sexually transmitted diseases, as well as a risk of birth control sabotage and reproductive coercion. We definitely see students likely to engage in other unhealthy behaviors like abusing alcohol and drugs. And if a student has been victimized in a dating relationship in high school, they are much more likely to experience victimization when they're in college and later in their adult life.
And I think some of the things you pointed out about this is that when you are working with a student, it may look like depression, right? Or it could look like, well, there's high use of alcohol. And so part of what we're going to talk about later is how do you kind of get behind that and say, let's talk about it. You're drinking. What are what's going on in your family life? So I think that's one of the reasons we want to highlight this too, is because you may not, and a lot of times, survivors of dating abuse will do very much to hide that, so that you may see it manifested in another form.
For sure. We also know that if a student is experiencing domestic violence in their home, or witnessing their parents in an abusive relationship, they are much more likely to become involved in an abusive relationship themselves.
So I think after you hear 1 and 3, and after you hear those kind of things, I always kind of go, well, what can you do? So we did want to provide that framework, because I think sometimes it is almost startling to see how widespread this issue is, but we also really want to focus on, well, what can we do? What can we do as a community? What can we do in our schools? And what can we do in our individual lives? And I think you missed it, but Barney was talking about the Aggies and being proud. I'm proud of Texas's policy response to this issue. We are so ahead of the curve, and it is huge to see what this state has done around dating abuse. The commitment that our legislators, that our governor, that our entire state has put to this issue is huge. This slide has a very brief kind of framework. We obviously can't speak about every bill here today, and y'all might get bored if I did. But we want to focus on 3 of the more important ones. The first is in 2001, we were one of the states to add an explicit definition of dating violence into our family code. So previously we had family violence defined, but we were able to add that definition. In 2007, one of these really landmark pieces of legislation, one of the first states to do it, was House Bill 121, which required that every Texas school district adopt a dating violence policy. And then just recently, last year, maybe even most important for folks who are on the webinar today who work in school health, is that domestic violence programs are now specifically listed as permissive members of your local school health advisory council. That's kind of a 30,000 feet look, and now we're going to look a little more in depth into the latter 2 pieces.
Great.
I feel like we cannot go on and talk about House Bill 121 without talking about some of the events that led up to it. I don't know how many folks are familiar with that legislation, but unfortunately there were 2 tragic deaths in the Austin community. Trella Mosley and Jennifer Ann Crescenti. Trella Mosley was killed on campus, and Jennifer Ann Crescenti was killed by her boyfriend. And it really left everyone saying, we've got to do something about this. This is simply unacceptable. These 2 beautiful young girls were killed by their boyfriends, and one, in fact, like I said, on campus. And so I think as a community, as a state, we all said this is not okay. And Carolyn White Mosley, Trella Mosley's mom, who is a fabulous advocate on this issue, and Jennifer Ann Crescenti's parents and grandparents worked together with Representative Donna Dukes to think through what is the approach. We need to do something. And Texas's response to this was to require that teen dating violence policies in schools. HB 121 created Section 37.0831 of the Texas Education Code, which we'll talk about in detail in a minute, but really what it did was create that every school district has to adopt a dating violence policy. So definitely, I would ask, kind of in your own lives, think about, do you know your dating violence policy? Do you know where it is? Do you know what the response is? And if not, please let us know, and we're happy to work with folks to adopt that policy. It not only lined out that you needed to have a policy, but we all know any good policy speaks to something. So this policy not only has to include a definition of dating violence that's consistent with the family code, but perhaps most importantly, it addressed some pieces that every school district needs to have in place in incidences around dating abuse. The first is safety planning. We know one of the most critical things we can do with anyone in this situation is to sit down and safety plan with them, to discuss what can we do to get you safer. It also asked for a plan for enforcement of protective orders and alternatives to protective orders. Sometimes it may be simply changing a class schedule but not doing it in the computer system, alternating routes. Obviously that's a piece of safety planning as well, but it kind of requires you to think through what does that safety look like, and includes those pieces. It also asked for training for teachers and administrators. We know how hard y'all's job is, perhaps the hardest there is, and the most responsibility. And so I think sometimes it can feel like you need that backup to be able to respond to this issue. It also asked for the policy to address how you will provide counseling for affected students. And really, kind of a lot of what we're going to talk about today is it also said we have to make sure that students are aware, that they're aware of how to recognize it, how to respond, and really how to prevent it before it happens. As I said, it was a huge piece of legislation. It's been amazing to see how many districts have adopted policies. I think, if you go to your district's website, many of your districts will have that policy in place. What we would like to talk about more is how do you implement a great policy once it's already in place. We continue to work on this issue, and we had heard from folks, stakeholders, not only in the school community, but advocates, survivors, saying, a lot of great work has been done, but there's more. There's more we can do, and in particular, there's more we can do around making sure teachers and students are aware of this issue. And not only the statistics, which are really important, but what do you do when this occurs in your community? So we at the Texas Council on Family Violence were again, pleased to work with the Texas legislature to pass a bill last session that was Senate Bill 736 that we referred to earlier, and it really supports connecting, your experts on dating violence in your community with the experts already on your school health advisory councils. It makes a partnership between those two places so that everybody's coming together with their kind of respective expertise, and it also means that you can have a community response to this issue, because I could sit here, anyone could sit here in Austin and say, here's the right way to do it. But we don't live in your community, you do. And we know that particularly when you're talking about school health and the school community and those types of issues, it's really critical that the community has a voice on that. And so we saw the school health advisory councils, which I know are relatively new to the code, to be an excellent place, particularly also because they provide recommendations on the school health curricula. So it's a chance to say, here's this issue we really do want it addressed. We already asked for the policy. The policy already said, please speak to awareness education. So let's put this together with our health curricula. Just some highlights. That was the general theme of it, but it really is an important tool to kind of begin working towards even more an enhanced discussion and compliance with the awareness education pieces. I think part of it is everybody would like to do everything, and we all can't do that. And so this is a way to put those pieces together. It also, like we said earlier, we'll talk a lot. Dating violence, domestic violence is a health issue. And so we see that this is a completely natural fit, particularly when you're talking about how do you prevent violence, how to stop violence before it occurs. In the health curriculum, you have an excellent chance to talk about the risk factors Abe mentioned, to talk about how those pieces come together. And like I said, it also puts experts together. It puts all the different experts from different parts of the community together, because you have on a shack many different members, and primarily you have parents who know their kids, parents who know their community. And when you partner that with an expert on dating violence, you have a great fit for moving forward on how is our community going to address this. And one of the takeaways we really wanted to say is that we know health is no longer a requirement, optional, but it is critical that it becomes a part of that program anyway, that we are talking about for the reasons we talked about earlier, because kids will do worse in school. Kids will have other behaviors. And so if we're not talking about it in our health classes, where is that information going to be? We also just wanted to offer y'all some tools just for implementing the policy response. Number one, family violence programs are located throughout your state. There are 79 funded programs by the Health and Human Service Commission. There are over 100 throughout the state. And I have never seen a group more excited and more willing to work with the school system, because they know what you do. They live in your community. They're really aware of how that connection can be made. So I would say, reach out and say, hey, I've heard about this shack bill, are you on it? Can we talk about how to work this into our school? Can you come in? We know that resources are always tight, and family violence programs are typically more than willing to come in for free, be a part of the atmosphere. And so you've got a link here so that you can go into our service directory at the Texas Council on Family Violence online and find your local program. Also talk to your shack and say, hey, have you heard about this? Are you thinking about dating violence in our schools? I'm interested in doing this. What can we do together? And then lastly, if you don't have a dating violence policy, and I definitely urge everyone, the number one step when you come off the call would be to say, do we have a policy? To go and find the model one, work on adopting it, tailor it for your needs, and the link is available there. And it's something you can look at and tailor, because again, every community is going to be different. I'm going to go ahead and pass it over to Abe. I think we've laid out some of how the policies are in place, but it still leaves, well, how do you implement that? So I'm going to go talk to my shack. What do I do? And I'm going to go ahead and pass that to Abe.
Thank you, Molly. So will you pass me the computer, or will you page down for me
at
the appropriate time? Okay, wonderful.
Hopefully the appropriate time.
Okay, thank you. Now, I know that we started a little bit early on this webinar, so I just want to check in with my time and find out what time we will be ending our particular session.
You have plenty of time.
Great. Okay, thank you. So when we talk about awareness and prevention education for students, we're really looking at a school-wide approach. It goes beyond curricula, because as we know, the greatest influencers on students is students themselves, their peers. So we are looking at an environment that we're going to actively cultivate that focuses not just on creating a conversation around the problems and the risk factors, but that focuses, like this slide just describes, on actually what the positive and healthy factors of a relationship can be. This slide is a graphic from Love is Respect, which is the National Dating Abuse Helpline. And it's a graphic that they created with a bunch of teenagers and students in college who are their volunteers and interns to describe really what, they ask the question, what is love to you? And that is the starting place for talking about these issues. So we're looking, can you page down for me? Thank you. We're looking for a school-wide approach that that starts, yes, with a healthy relationship curriculum that's delivered at all ages by our trained educators, and that's developmentally appropriate. Secondly, we're looking for the cultivation of a school culture and a climate where abuse is never tolerated. We'll come back to that. And third, as Molly said, we're looking to have your school connected in an active and a friendly relationship with your local family violence program. There are many ways that your local family violence program would love to work with you, and I'll get into those a little more later. So we're actually going to stay on the previous slide. So when we're talking about healthy relationship curricula, we're thinking about awareness education, but we're also really thinking about prevention. And how do we prevent the violence before it even takes place? And we've learned that it's not enough actually to provide curricula for high school students. As Molly said, students are already dating in middle school, and in elementary school, they're already forming their understandings of what it means to be personally aware of themselves and their relationships with others. So our hope is that we see it as a spectrum from pre-K to college, and that prevention can be delivered should be delivered at each stage. So when we're talking about from the tiniest little kids to the end of elementary school, we're looking for social emotional learning. These are some model programs that are evidence-based. We look at Oleaus Bullying Prevention Program as one of the very best programs for elementary school. We also recommend Second Step as a social emotional learning program. How can I click back up here?
Can you do that? I could fix that for you.
Oh,
is that where you?
Thank you. That's where I want to be. Yep. Okay. When we get into junior high school and high school, we're looking at a curriculum called the 4th R. This one is interesting because it really posits that reading, writing, and arithmetic are, yes, the core skills, but without relationships, without learning explicitly about relationships, the reading, writing, and arithmetic won't happen at their best. So the 4th R focuses on the relationship as the core and works with students to improve their decision-making around all the risk behaviors that could take place in relationships. When we get into high school, the evidence-based curriculum that we are supporting most here at Texas Council on Family Violence is Safe Dates. And Safe Dates is a 12 to 24 session curriculum, 1 hour weekly sessions that help students understand the differences between safe and supportive relationships and abusive and controlling relationships, and gives them a lot of hands-on practice in identifying what it is that they want in a relationship and how to communicate that, and how to basically say yes and how to basically say no to what they don't want. So we're looking for these. We're looking for curricula to be delivered at all ages, and that's something that you can really influence. And we're hoping that in the shacks themselves, once the family violence program has a representative on the shack, that relationship can be used to influence the school's choice of curricula. Secondly, we're looking for the cultivation of a student culture and a climate where abuse and violence are never tolerated, healthy relationships are celebrated, and bystander intervention is the norm. If we can click up one, Molly, that would be helpful. Great, thank you very much. When we talk about bystander intervention, this is the other core piece of preventing dating violence in schools. As we said, it's students who will assist students in making their best choices. And bystander intervention is a school of practice which teaches students how to recognize dangerous situations and how to take action to protect themselves and to protect their friends, and particularly to step in when they see risk factors such as a student being afraid around her boyfriend, a student becoming isolated and withdrawn, um, anything from boys discussing girls in sexually objectifying ways in the locker room. That's an opportunity for bystander intervention for a young person to say, hey, I think we should speak more respectfully, to seeing a girl at a party who's not not in full control of her sobriety and saying, hey, can I help you get home? So bystander intervention is that whole range of choices that a young person can make to step in and create safety for themselves and their peers.
Which I think seems really important when we do know that a third won't come forward, and what you said earlier about the community, that youth want to talk to youth.
Right.
So if we can prepare other youth to be able to respond and to say, hey, that's not okay, then we're beginning that whole school health community.
Absolutely. And it's fantastic that we start with the policy and that we have laws in place. But we know that laws change culture, but really it's people who change culture. And it's the conversations that youth are having amongst themselves about what is and isn't okay in a relationship, what does and doesn't feel good in a relationship, that will really set the path for what they choose. If we have a culture of bystander intervention at our school, that really radiates out into preventing all different forms of violence. And once youth feel empowered and have the language to discuss healthy relationships and dating, abuse, and violence, then the key component in cultivating a real school culture is supporting the youth leadership. You may not have funding to bring in an extensive healthy relationship curricula, but you certainly have a lot of teenagers or children on your hands, and they are very interested in being engaged in meaningful ways in helping their communities. So even if you were to support youth leadership in the form of a youth task force or a youth voice on the student council who's equipped to talk about dating, violence, and relationships in the schools, any way that you can draw young people in to be leaders in the conversation, you'll see an exponential effect on the student culture. When we are giving resources to young people and talking to them about what to be looking for in their relationships, we really want to make sure that those resources are youth-sourced and youth-driven. So we want to look for things that are specifically targeting the population that you're working with. And I want to direct us back to Love is Respect as the source of a wide variety of resources that you can hand out to students. Beautiful posters to put on the walls, wallet cards, their phone number. They are accessible 24/7 for chat, text, and hotline calls from young people. All right, so that's a lot. Those are three big ways to approach your school-wide community change. We're going to scroll down through. Thank you, Molly. Great, to cultivating our school climate. We know that young people are in need of caring adults who are able to talk to them about anything that they're experiencing in their lives. And we know that that's probably, that half of the job of an educator is being there for the students. And so we're looking at how to create really open, safe dialogue about relationship matters between teachers and students and counselors and students and nurses and students. And that starts with us asking the question, so are you seeing anyone? Are you dating anyone? How's it going? And really bringing that into a natural and normal conversation in the school. We'll get into that a little bit more when we look at the wallet cards that are available for clinicians and teachers to hand out to students and to facilitate conversations. Another way that the school climate can be cultivated and that prevention can really be deeply rooted and sort of enmeshed into the school culture is through sports-based prevention efforts. There are, in Texas particularly, we have a really big focus on a program called Coaching Boys into Men, and you see the acronym there, CBIM. Coaching Boys into Men is a wonderful free program that the Texas High School Coaches Association has endorsed. And it gives coaches tools to talk to their athletes about what healthy relationships are and how boys in particular can respectfully and safely relate to girls and women. And so there are a series of talking points and playing cards, playbooks that that coaches refer to at each game and each practice for ways to start this conversation with their athletes. We know that athletes are real influencers in school environments. So if there's a way to get a sports-based prevention program and really build an alliance with your coaches at your school, that's another wonderful method to approach prevention of dating violence from an unusual direction. Nurturing student leadership against violence, we spoke about that. We can approach it if there's no funding for curricula. We can approach it through service learning projects. Many schools have requirements for students to get out into the community and find ways to be of positive use through volunteering, etc. Your local domestic violence program, family violence shelter prevention program is a perfect place for students to meet adults, have a sense of responsibility, and really understand the spectrum of issues that their community is facing. At family violence shelters, there are almost always mothers with children, and a great way that I've seen Texas high school students get involved is to provide activities, art, coaching, basically playing with students, playing with kids, doing childcare. Other service learning projects that I've seen work well in Texas is to create a team of teenagers who are interested in doing peer education with younger students. So if you have the ability to convene a group of young people to talk about dating violence and determine what they think the biggest problems are in their school and in their relationships and their environment, then they can design presentations to give to we typically recommend 3 grades below them. So even in middle school students in Texas are going into elementary school classrooms to talk to children about not specifically about dating, but about how to relate to one another with kindness and empathy.
And I think just to speak to the impact of what you're saying is that is how I came to this field. I was 14 and volunteered from school in a service learning project. So and then here I am. So I think it does have a huge impact when you begin to see things firsthand. You know, I worked in a children's program as a volunteer and just never left. And I think part of it was the impact of doing that work. So I think you can't underestimate what that's like to firsthand go in, and it was playing with kids, as you say. So I think, especially when we're looking at financial challenges that we all know that can be a great option.
Yeah, I've heard it from many people in the family violence field that they actually began as teenagers volunteering and were just caught by the fire of seeing people work to make transformational changes in their lives and seeing people come to safety who have otherwise been in very challenging life situations. It's inspiring. So when we talk also about service learning, we know looking at the curricula, as I said, we're looking at providing prevention from pre-K to 12th grade, and in the elementary and middle school ages, we're really seeing, obviously, we're focusing on the issue of bullying. And when high school students are going into junior high and middle school classrooms to talk about dating violence, they're grounding that conversation in a conversation about bullying. They may or may not be calling it gendered bullying, but we know that bullying is taking place in the context of who do you like, who do you not like, in the context of boys not acting as boys, girls not acting as girls are expected to act. So a lot of the bullying is taking place around gender presentation issues. We know that bullying, students who engage in bullying are more likely to engage as perpetrators of dating violence and later as family violence. So in that respect, it's really critical for in prevention of dating and domestic violence to start with prevention of bullying. So that's another place in which teens can be extremely helpful and motivated when they go into talk with younger students. In terms of raising up youth voice, we want to look at creating art and spoken word forums. We want to give opportunities for young people to speak out to one another about the violence that they've experienced or witnessed in their lives, and to create that public conversation with their passion and their emotions. And we want to make available posters, public service announcements, wallet cards, and all sorts of other resources. Youth-friendly resources. Love is Respect, the National Dating Abuse Helpline, is really your best friend. As I said, they answer calls, texts, and chats 24/7. And they, unlike the National Domestic Violence Hotline, Love is Respect is staffed by young people, and we've learned that that's really critical. That young people do not want to talk to adults about the problems in their relationships. They want to talk to other young people. Love is Respect offers wallet cards that can be handed out to students and can also facilitate a conversation. If you'll scoot down for me, Molly, here's an example of their primary wallet card, Love is Listening. This is, it's tiny, it's the size of a business card, which is important because if a student is in a dangerous or victimizing situation, it's necessary that she or he not be caught with materials that could antagonize their abuser. So this is easy to put in your wallet, easy to conceal. If you could scoot down for me a little bit. It gives us an opportunity to look at the warning signs of abusive relationships with teens and to expand the conversation. When we say dating violence, teens often think, well, I'm not being punched. I don't have bruises, so this isn't a dating violence relationship. So it's up to us to expand that conversation to help them understand that any relationship that is based in the use of power and control is in fact an abusive relationship. And that can look so many different ways. It can particularly nowadays manifest itself in technology, in control through the use of Facebook, through checking in locations, through tracking a person's whereabouts. So these are questions to ask your student. Does your partner check your cell phone or your email without permission? Do they put you down? Are they extremely jealous? Do they get upset when you talk to your friends or when you talk to people of the opposite sex? So it's a way to really start that conversation and then to give them the info in their hands about how to talk to their peer advocates. Another safety card that I want to direct you towards is called Hanging Out or Hooking Up. And this is created by a program called Futures Without Violence. And it challenges teens to consider how are they being treated, what are the dynamics of their relationship, and how to confront what's going on with actual statements. It also gives students resources about suicide prevention hotline, Love is Respect, That's Not Cool, which is a website particularly about cyberbullying and use of technology. Scoot down for me. Here's an example. Let's see. Oh, right. Okay. This card is really helpful because it's gender neutral. So when we find ourselves slipping into talking about he as abuser and she as victim, but the relationships, unhealthy relationships work in all different ways. They come in every possible form. So it's important that we approach this with gender neutral language. Also, we know that 1 in 10 students is lesbian, gay, bisexual, or transgendered, and these cards have neutral language also around that orientation in the relationship.
Here's an example of one of the pages of the card. How is it going? It might be a little bit hard to read. They're pretty small. Um, the card is useful both to hand out and as a guide for clinicians to simply follow the conversation. Take the card out, unfold it, and show it to the teen and ask each question. Does the person you're seeing treat you well? Do they respect you, including including your feeling of comfort and boundaries around sexuality? Do they let you wear what you want to wear? Something as basic as that will evidence whether a relationship is based on mutual equality or is based on power and control.
I think the other thing about these two, Abe, is that it gives you the chance to have that dialogue because for youth and even for adults, sometimes you're like, well, those texts do feel like he loves me because he cares so very much about where I'm at. And I think these cards and the resources let you get kind of under that issue.
Right. Power and control in relationships can often mask themselves as just being extremely in love and wanting to talk all the time, not wanting to be with anyone else. It's difficult for adults and for teens to determine what the limits are. And the guidelines you really go back to is how does it feel for the student? If she or he is anxious, if she or he is exhibiting these risk factors, then that's the time to say, I see that I see that you are feeling depressed, and I want to say that I want to talk to you about your relationship. Scroll down for me, thank you. Here's an example of what Molly just talked about, how to talk to your student about about how to respond back to a partner who is crossing over boundary lines with them. So in particular, this is really critical because, as we said, power and control does have this whole new playground of Facebook. It's important that clinicians and teachers be aware of the degree to which social media and technology are abusable in the lives of teens, and to have that conversation with teens as well. We know that teens know way more about the internet than we do, and so they might need to update us on that. But that's an important thing to approach and address as well. Can I get a time check?
I think we have just a couple minutes left.
Okay, thank you. So if you do encounter the situation where a student discloses to you that there are problems happening in their relationship, that's when your ability to be an empathetic listener, to affirm what they're saying, and to really follow their pace in the conversation becomes critical. It's hard when we learn about anyone who's involved in an abusive relationship, not to want to fix it and to jump in and have an answer and a response. It's hard with adults. It's even harder with young people. And so to remember that the young person herself is really the best judge of what to do and when to do it in her relationship to maintain her safety. We want to present all of the options and resources that are available to her, and then we want to empower her to make those choices herself. Giving these resources giving out the resources is one important step, but know that if a student has disclosed to you, you may be the only person in the world that she has shared that information with. And that it's the way that you handle that information may determine whether she ever tells anyone else or seeks help. So when we start the conversation with students about their relationships, of course we have to tell them about the limits of our confidentiality at the start, so that they are aware that if they disclose something to us about that they are at risk of hurting themselves or another, or if they are being abused by an adult, that we do have to report that. We are mandated reporters. So a student needs to know that if she talks about certain things, we will need to take it to the next step and can't maintain her confidentiality. That said, once a student understands what those limits are, we want to create the safest and most nurturing possible emotional space for her to share um, what's going on with us, and we want to make ourselves available over time. It's not a one-time conversation. Identifying, gaining strength, and leaving a relationship that's based on power and control can take a long time. And we want to be there to provide the student support for as long as she needs it in each stage of the process, and to honor that she herself is the best judge of when things happen and how.
And you know, I think it's hard sometimes when you have someone come back and come back, but I think we always say there's no better compliment to you that a student would keep coming back. That they do feel they can continue to come back to you. So even though it's hard as people who are in this because we care about youth and we care about their well-being, the best thing we can be is the person they come back to.
Well said. So we're going to work on building a connection with our family violence program.
I think we have just like 1 minute. We need to.
Okay, wonderful. Your family violence program will do everything needed to support you in creating a safe school environment. Especially if you have students who are coming to you with disclosures. Contacting the counselors and the advocates at your family violence program is your best source of support. Teachers and counselors and school administrators are also exposed to a lot of difficult material and may need guidance and support themselves dealing with vicarious trauma. So we want to wrap up by saying thank you for the work that you do, and thank you for believing that every person deserves to live a life free of violence and abuse.
And thank you so much for having us here today. It really is a humongous opportunity to talk to people who have such influence with youth. So thank you, and thank you for your time.
Thank you.
And I think right now we're just going to work on how we are able to get to the next presentation.
Thank you both. Does anybody have any questions right now for these two ladies?
Yes, for Region 1. Could that PowerPoint be sent to us?
We'll post it.
Yes.
Yeah, they're going to post it on the website for actionforhealthykids.org. I can send you out a message to all the ESCs so that you can spread it out. We can't send it to the listservs anymore because they're just too big.
And our contact information is on the slide. We would love to hear from you. If there's anything that we can do to kind of make this work easier, please don't hesitate to contact us. We know you already have a big job.
Yeah, appreciate it.
All righty. Any other questions? Okay. Well, thank you very much for coming today. We're going to go ahead and go to our next presenter.
Anita. Put Anita. Who's
Hold on just a second. Hold on just a second while we do some technical.
We're going to change our order up a little bit from the agenda, and Anita Wheeler with Department of State Health Services is going to talk. Oh, that's okay.
Are y'all there?
Yes, ma'am. Just I would sing to you while you wait, but we're just trying to get caught up and get the next presentation on here. Our computer is somewhat old, so we're just trying to do the best we can. If you hold on for just a second.
Thank you.
Thanks.
Row, catch, family, right, third from the left.
I know I can't do anything yet.
If you want me to, I can go ahead and get started though.
Okay. Well, good morning to Anita Wheeler from the Department of State Health Services. I still want to call it TDH because that's how I knew it for about 15 years. Anita's going to talk to you today and give you an update about communicable diseases. So good morning, Anita.
Good morning, everyone. First of all, greetings from the Department of State Health Services. We really want to give you an update of some of the information that's been shared with us related to the communicable disease chart, as well as the rules that schools implement in as it relates to communicable disease. She's in the process of getting up my PowerPoint, and there it is. And we will make this available, as we said. Michelle's going to put it on the website so that you'll have access to it. Mine is pretty much just so that you all out there in webinar land don't have to look at me, because I don't guess you can if you're on the webinar. But it's also a way for me to keep on track. As I said, the department has recently updated the communicable disease rules. The communicable disease charts will be ready. They're projecting January, mid-January, maybe early February. Today we're going to talk about the impact that these revised communicable disease rules will have on schools related to exclusion and reentry procedures for the school nurses and those that deal with this issue on a daily basis. As you can see on this PowerPoint slide, the charts are going to be due for dissemination around January, February 2013. I have not seen the final draft of the actual chart itself. What I do have access to is a copy of what was posted on the web for the rules development. They were posted on August the 24th for the 30-day comment period. I'm not exactly sure how many comments they got, but they did get some comments back, and so what they're in the process of doing now is finalizing all of those comments and getting them for final approval. I will let you know as soon as they are up for final adoption so that you'll know when this all goes into effect. They've changed some things in here based on input from school nurses and school administrators and those who are out in the field. As you can see on the slide, the temperature has been changed to now a temp of 100. And one of the things they put in the language that I think you need to be aware of is that a temperature is 100 degrees Fahrenheit or 37.8 Celsius or higher, and that this measure is done when there are no fever suppressing medications given. So in other words, I understand that some school nurses are having a problem with parents giving a child Tylenol or Motrin before they come to school, and 2 hours or 3 hours later the child begins to develop a little bit of a temp. And so they really want to make sure that people understand that the temperature is 100 and that fever-free means that there should be no fever-reducing medications on board at the time. So that's a pretty big change for how things were done in the past. The second definition that has been changed is the definition of diarrhea. And it goes 3 or more stools in a 24-hour period. And in the actual rules themselves, the way they define diarrhea is that the stool actually becomes the shape of the container in which it's held in. So that kind of makes it interesting in the fact that, you know, they've actually defined that the stool itself conforms to the shape of the container that it's caught in, which I don't know how many people are going to be catching it, but that's just for your own information. The other big change that came in is that head lice is no longer an excludable condition. And I have heard quite a bit over the last few weeks from schools who are saying we have a really bad problem right now with head lice. However, they have taken it off of a communicable disease chart because primarily it's more of a nuisance and less of an actual communicable disease. And so schools can be more restrictive than what the rules say in some areas where they may want to say that after a certain time, or that they need to work on this at a local level because it's no longer actually an excludable condition according to what's been posted on the rules this time. Now, they did add some new reportable conditions, and I'll be real honest with you. Some of this is very familiar to me simply because we've had, the influenza, we had the H1N1. So that's one of the reasons they put novel influenza on there, because that was a new situation that we ended up with here in Texas. Who knew that it would start in our own backyard? But things like the amoebic meningitis and encephalitis, we've heard a lot about that. Children swimming in fresh water, getting an amoeba, and then it causes life-threatening meningitis and encephalitis. Some of these other diseases, what I'm going to propose that I do is I'm in the process of putting together some fact sheets with our infectious disease folks so that you kind of have an understanding of what those other diseases are. Hepatitis E is one that's kind of new. When you look at it, it used to be hepatitis A, B, C, and then they had a D, and now there's an E. So that's one of the other ones that you need to be aware of that is now on the reportable conditions chart. Most of this applies to someone in an acute care health system. Things like the novel influenza, you may be asked by your local and regional health departments to assist in identifying cases of that. And I think it's important that we understand what's in the chart and then kind of understand who is responsible for reporting. Most of these on this list are reportable by the labs and the physician's offices that actually conduct the testing in identifying and diagnosing these particular disease processes. Other proposed changes, they have discovered that because of an increase in nurse practitioners and physician's assistants who are actually doing primary care, they have now added in the rules some reporting requirements for those two professional groups, primarily because many of them are working in very remote parts of the state where they don't have a physician or even a local laboratory or a local health department. So they went ahead and added language to help identify those that really do provide primary care out in those rural areas. And then they've added language related to the influenza pandemic. And at any point in time, we know that that's always something that can come about. And so they really wanted to make sure that they were covered in how that was written into the rules so that in the event we have another H1N1, they have a way to actually work through that with the local authorities and with the local health departments and those out in the communities who literally are the ones on the first line of all of that information and getting that information shared with the appropriate authorities. At this point, that's pretty much what I have with the infectious disease chart. Like I said, we want to make sure that you all understand that the chart should be available January or February. Because of the current chart being very difficult for elder eyes to see, like mine, I think they really are looking at making sure that whatever the chart is can be downloaded easily off of a computer. We've been instructed by the department to not do paper copies of things, that we really want to make sure that we are coming into the electronic age. So as that becomes available, I will get it out through every group that I possibly can. We'll send it out through both Kathy's listserv and our listserv, and we'll send it out through the service centers, any way that we can get that information out to you. But I would bet that there's not going to be hard copies available, that this will be primarily something that is downloaded off of our website. And we will send the links to where you can find all of this information, as well as any of the additional resources that really might help you and your school with the not only the chart, but with all the new diagnoses that have now been placed on the chart. And I have to admit, I mean, I'm going to have to look some of that up because I don't have a clue what that is. I mean, I didn't have time before I got here to look it all up. But, you know, we are dealing with a lot of new things that we've never dealt with in the past, and we want to make sure that they are reflected in the rules, but also in the communicable disease chart. So that's all I have for you all this time. So let me know. I'll be around so that if there's questions at the end, we can answer those questions.
Thank you very much, Anita. And yes, she'll still be here, so she'll be able to help you with any questions that you might have. One of those that I saw on there, Chagas disease, is from my medical background, is sleeping sickness, which you only found in South and Central America. So it's you know, it's just because we're such a global society now that many of those things are coming our way. The next person I'd like to introduce you to is Nancy Guerrero, and she is the middle school principal at CD Folks in
Round Rock ISD.
And she's here to talk to you about the Family Fitness Fun events. So it sounds like a fun thing after kind of the downer about the communicable diseases. Let me introduce you to her first. This is Nancy.
Good morning. Thank you for joining us this morning.
I'll work on getting her PowerPoint up here in just a second. Okay, we are ready to begin.
Okay.
Thank you, Nancy.
Oh, you're welcome. Is this all ready as well?
All ready.
All ready. Great. Well, we have been very fortunate in Round Rock ISD and specifically at CD Folks, my campus. For the last 3 years, we have implemented the Catch Family Night and have been in partnership with the University of Texas and the Michael and Susan Dell Foundation for Healthy Living grant. So we have really implemented a coordinated approach to children's health throughout our school building and specifically highlighted an event we host once a year. In the last 3 years, we have hosted from 350 individuals to 600. So we have really become a leader in Central Texas in relation to being able to pull together a really amazing family event that's all centered around healthy choices, activity, and healthy eating. The coordinated school health and catch is the idea that we are bringing the school community together to teach children and their families about healthy lifestyles. I specifically talked about the coordinated approach to child health, which we refer to as CATCH, and it's a program that promotes that physical activity and the healthy food choices, along with a coordinated and able to do program that goes campus-wide. And when we say campus-wide, we really practice what we preach. And so not only do we have physical activity daily through our PE classrooms, we actually incorporate activity breaks into our classrooms to break up the instruction. We tie it to our instruction, so it really is exciting to see. It helps with our transitions in the classroom. Perhaps if we are in direct teach, we may implement a activity break as we transition to maybe a cooperative center. Also, we integrate activity breaks for formative assessment, just to kind of assess where students are and are they getting it. it ties rather well to brain research, especially for adolescents. So what is a family event? The event is really to promote this healthy lifestyle. It's free, it's fun. It really is a great time. My family comes out as well, as do my teachers' families. It's designed to reinforce the healthy eating and physical activity behaviors for not only students, but all family members. So now that we have become veterans in promoting this family event, it really does require a lot of behind the scenes kind of work. We begin by making our plan. We really do promote and believe in our event. And so there's a lot of excitement that we build as a committee, then as a faculty, and then out to our partners like PTA and all of our business partners. We recruit the faculty and the staff. So I, as the principal, can help promote and build that excitement and require my faculty to be a part of the Catch event. They do all come out and support the event. And then, of course, we make it happen. So the first step, establishing the planning committee, it really takes a team to be able to coordinate events such as this when we're hosting over, on average, 500 people. To have the support of the principal, I think, is critical. It is what really allows everyone to start to buy in, but of course the principal cannot do it alone. We involve our facilitator. I don't facilitate the committee. I have my Catch champion that really is the leader in activities and the Catch program to facilitate. But we have teachers on the team, PTA members, the nurse, our after-school program coordinator, and we create our Catch team. We select, of course, at CD Folks, we have our program in the fall. We always have it in the evening from about 6 to 8 always. You can adopt a theme, and then you determine the availability of the facility. We do like to use the entire campus because I'll share with you in a little while that we have zones. Because we open up the school, I always try to tie it back to learning, and so it was at CD Folks that we created the 4 zones for a really positive family fun event that ties school and learning with those healthy activities. So our zones include information, nutrition, school, and physical activity. Again, to make it happen or to have your plan, you have to have the players to consider. Administration, we do involve students. Student participation is big. Food services, we coordinate with our food service community members that really buy into and help support the overarching idea of Catch. And then community vendors, everything from the health district, so local healthcare providers, to YMCA, the hospital, the grocery store, and health stores. To build that excitement, we really begin with that committee to recruit. We recruit and we promote. We go out to all types of grocery stores, all types of areas in the health industry, also anyone that's involved in promoting physical activity. We're out there and definitely using our networks. We promote to our families through newsletters and flyers. I send home a progress report or report card every 3 weeks. So early on, I make sure that we include a save the date invitation followed by a formal invitation. We also use our marquee and our e-news and everything that campuses have access to. What has been most positive is we have an advisory time on my campus in my schedule, and several years ago I started having scripts created for our students. And so now we have our students called during the advisory time to remind parents and to save the date. And of course, in this 21st century, we do allow students to text their parents the day before and the day of the event. So promoting it campus-wide, We also really pump up the excitement for our students. We start talking about it on daily announcements. We have it on scrolling announcements throughout the day. It's published throughout the school, and we integrate it into the conversations we're having in our classrooms, both academic and in PE classes. Once we hit that night, again, we host it in the fall, but you can also host it in the spring, and we've incorporated catch events in our spring events. Again, we are celebrating healthy food choices. These are actual pictures from my campus and our students participating. This is taking place in the information zone, and there is a lot of physical activity going on. We have students that Zumba. We have students that figure out and learn about bike safety. And so, again, we're promoting that physical activity for the entire family. Who can come? We promote it for the entire family, really working to ensure that young ones, along with their older siblings and current students, are able to come, mom and dad. There are activities for everyone. So what will we do when we're there? Again, I shared the 4 zones. We do create a passport for our students that I will share in this PowerPoint shortly, but students attend all 4 zones and are required to actually connect at some of the tables in those activity zones. So here you can see we have the information zone with the after school program table. The school zone includes extracurricular activities, so I have campus clubs and organizations that are promoting what they do for the school and around the school. We also include and have been able to coordinate having the book fair the week of our family night, so that families can peruse the book fair and be able to participate that way. We promote college and career readiness, and actually this year we even had a technology zone where students could go through the career cruising software that we have available to our students. We share what we have available through technology. We have a program called Gateway, and so that's typically highlighted in this school zone. The nutrition zone, or as our students call it, the food zone, is filled with healthy food samples in the cafeteria. So we have our food services present. They provide samples of what students are served on a daily basis. They provide recipes for what families can replicate at home. We have invited 4-H. Aspire is our after-school program funded by a 21st Century grant. We have had the HEB chef come. We have had Food Fit. We have had Schlotzsky's. Again, it's about networking and getting your partners to come in. They are more than happy to be able to promote their services and also provide free samples to our families. We also have been able to partner with some of the stores in our area to get shopping bags that we fill with healthy snacks for every family that attends. The information zone takes place in the gym on our campus. And as I said, the health industry comes in. We have orthodontists, we have chiropractors, we have Austin sports area, the YMCA, we have Zumba going on. The hospital typically comes out. Previously, we've had Bucks Bikes come in that have checked helmets. We have also had Texas Stars come in, so partnering with the basketball teams and the hockey teams in your area is really positive because they have little opportunities for students to engage in physical activity here. And here's a little sample of what Bucks Bikes was able to do. They actually checked kids for helmet fitting. We had some giveaways by Bucks Bikes. So again, networking with those partners in your area. The activity zone takes place out on our football field, and this is probably the most popular for our families. We have had everything from fishing and rock climbing to obstacle courses. We've even brought out things like potato sack races and families racing one another. We've had inflatables that are also obstacle courses. This year we were able to bring out our Texas Stars, and they had a hockey blow up where kids were able to learn what muscles are used. You know, everyone thinks that hockey is all about big guys, but it really is the forearm that really needs some practice and some physical movement. This is what our passport looks like. And so we have required stops at each of the stations because our activity zone is so very popular. A couple of years ago, we did require students. I apologize for that little technical difficulty there. We did require students to go through the first 3 zones and get their cards punched before going out to the activity zone. The really positive thing is that our kids come back to the nutrition zone and to the school zone and the information zone, so we didn't have any problems whatsoever funneling so many people through our campus. Now, it's always fun to have something to dangle for our students. And again, those partnerships really help out here. With those passports, once students turn those in completed, that they have visited all of the zones, they are eligible for a raffle. And we each year have been successful in getting a bike donated. We do have small funds through grants where we've been able to secure some other smaller items like basketballs and soccer balls and skateboards and sporting equipment. But we give away iPods, and we give a variety of giveaways, including baseball tickets, because we do have we do also have a baseball team in our area. Again, this is just a close-up of our passport for our students. I do color code them by grade level, just so that I make sure that we're also, checking attendance, because I do have an attendance sign-in, but also the giveaways. We like to make sure that we balance those giveaways. So we color code for my 3 grade levels, 6th, 7th, and 8th. That was really kind of the activities themselves. But again, we're still on step 2 and building that excitement. And that is to really promote the fact that it's free and it's fun and it doesn't take a lot of money, just a lot of coordination, because you have people willing to partner with schools, especially when it's around promoting those healthy lifestyles for our students for their future. Purchasing the prizes and highlighting them is all important in the promotion. And of course, prizes should promote physical activity and healthy eating. So I shared some examples with you already. Recruiting the faculty and staff is really key. Our families now, and our campus is very much a family, is really all about, when we're back in August, they already want to know when our catch night is. So we've done a really good job of recruiting the faculty and staff and getting their buy-in. We do have the faculty and staff actually facilitate the event, so we do have them sign up. So a lot of planning goes into where everyone will actually be for their stations, and it's shift work. So they're not there the whole night. They get to actually participate in the event as well. As I shared before, I actually require this of my staff, and I have had very few people that have had reason to not attend, and those are always really good reasons. Again, we do require our faculty and staff to promote in the classroom, in the gym, in the hallway, any chance we get. When I have my celebrations for honor roll, I start to promote the week or 2 weeks out. If anytime I can, if I have a group of parents in the building, I'm promoting our catch night. So making it happen, again, it's really PR and making sure that you are ready with your sign-in, that your cards are ready, that you have really organized the infrastructure so that it serves the population coming in. And again, we've been as small as 350 to 600, and those were guests. That was not counting my staff. encouraging the family to participate. The laughter, the smiles, the energy you see as families are coming in and leaving and thanking us for the event is remarkable. The students coming back and telling me that they played ball with their family is exciting, or sharing that they used one of the recipe cards they received from our food services or from HEB or from one of our other vendors is just remarkable, and you're making a difference. Announcing the prizes, we have found that we had to move that to during the school day, so we collect the cards because people are active and participating from the moment they arrive till the very last minute. I mean, we have to tell them it's 8 o'clock and now it's time to go home because we have school in the morning. So again, I talked a lot about the promotion. Students make signs. You can see there with one of our students and our school nurse. And then we have, of course, flyers that go out to our families. These are some of the samples of the food that we've had available for our families to taste and sample. This is just a sneak peek, and so I told you it's as simple as potato sack races. That was really very popular, even though the climbing the rock wall was a big deal. Some of our obstacle courses, you can see the go, slow, and whoa. Kids we were just having fun, and that was in our information session. But for students to be able to compete with one another and know with their families what food is really something you ingest regularly and those that you have to be a little more cautious with. Again, our information booths were really just ensuring that our families are taking care of themselves. And so there are some highlights of what we were doing, even checking blood pressure. Just some samples of some of our vendors there. And then our student groups just having a great time. Our dance team was featured at one of our events. A little idea of the kind of prizes that we do raffle off to our students. So now that we have actually been termed, the pros at this and get lots of visitors and lots of calls, the key is always just to really plan, and that you can't do it alone. So collaboration is really essential, and that when you do have a team, you can delegate roles and responsibilities, because this is where networking really pays off in leading a really positive, fun event, and just to promote it and get the word out there. I mentioned my faculty asking when is catch night. I now have families that have had students that have gone through and have new ones coming in. At my 6th grade orientation, I'm frequently asked, when is catch night? Document attendance. That's how I'm able to report the success we have had. And again, I've mentioned this before, just that staff participation is essential. So any questions?
One question come up about parent involvement.
Mm-hmm.
You get parents to attend the event. Do you have anything you do to keep them involved?
So I mentioned the school zone, the question related to how we keep parents involved. And I serve a Title I school, and for Round Rock ISD, sometimes that is a little surprising if you're familiar with our area. We really are considered a suburban community. But again, I have almost 80% economically disadvantaged students that we serve. And the families, because of that school zone, we really have that opportunity to really get our parents to sign up. What is essential is the follow-up with phone calls. They really need that personal touch and that personal invitation, but we utilize that event to be able to document how we can reach them. And then I do have committee members that go and reach out to them and ask them how would they like to serve. And so we see a lot more presence in parent participation. What it has also led us to do is provide parent information sessions or classes, both during the day and after school. We actually just hosted a parent information class this last week. And so I strongly believe that the hook came with this family fun event. And so that's really been beneficial. I have a parent resource center, and this is my 7th year as the campus principal there. We really didn't have volunteers that helped us, and now really the parents are asking for work. So they stay involved in supporting the school, but also continuing to learn. One of the sessions that we offer is related to nutrition for our parents. So really the sustainability is definitely a goal that we have, and something that is coming to fruition for us. And I really base it on this event where we really opened our doors to our community and invited them in. You're welcome.
Any other questions? Okay, well, thank you very much.
Thank
Nancy,
you.
for joining us. We really appreciate it.
Certainly.
We're now going to get ready for our next group. Just 2 of you. Mm-hmm. Here, do you sit here? Mm-hmm. Why don't you sit here by the fire? I have to sit here. I'm going to leave, but I have to drive. Okay, I just need the one side. Jackie's going to go first. So does she sit here? Or? You can switch out. Well, we're working on getting all of our seats situated. Hold on, I gotta give Nancy back her flash drive. Here. Okay, so you just need to go to the.
Yeah, Jackie's gonna go first, and then when she goes, I'll
Okay. All right. We now have Christy Denman from the Texas Department of. Jackie's. Okay, yeah, sorry. Jackie's going to go first. Jackie's doing a school nutrition update. So go ahead and turn that on. Okay. And I'll go ahead and bring you all up. I'm going to step out of the way here.
Hello, I'm Jackie Cantu. I'm with the Texas Department of Agriculture. I am the project coordinator for a new project we have going on this year for the school National School Lunch Programs called 6 Cent Certification. Just to bring everybody up to speed, if you're not aware, is that the National School Lunch Program did go under reauthorization and it was approved. Part of that reauthorization was that school districts can apply for an additional 6 cents for every lunch served if they submit their menus to TDA and we review them to ensure they're meeting the new meal pattern requirements that were outlined by reauthorization. This is currently going on, and there are specific rules or requirements as to what can be submitted as far as menus go. Current menus need to be submitted to us. And current is defined as if you're submitting in November, a current menu would have to be a menu served in November or October. When we move into December, a current menu would be a menu served in December or in November. So menus that are submitted always have to be menus from the month of submission or the preceding month. The reason I'm bringing up that point is that we're almost getting to the end of November. And once November's over, we can no longer look at menus served in October, which means that you would not be able to receive 6 cents in October. Again, the 6 cents is allocated to when the school district demonstrates that they have met the new meal pattern requirements. So if menus that were served in October were submitted and we certified them, we could we could go retroactively and apply that 6 cents to the month of October for all lunches served. As far as how it's going so far. Out of the 1,400 school districts that have that we have under the National School Lunch Program, we only have approximately 400 that have submitted. So those other 1,000 schools out there that haven't submitted, if you don't submit by essentially tomorrow, you're leaving money on the table for October. The soonest you could start receiving the 6 cents after tomorrow would be for the month of November. So I just really want to encourage anybody that's out there that has started working on their documentation to submit, to go ahead and get that information into us by tomorrow. If you can get it into us tomorrow, even if we have to go back and forth and work with you on making corrections, you've still submitted it. And so I can still retroactively go back to October. But it has to be menu served in October. Again, you can still continue to get 6 cents throughout the year. It's just as every month goes by, then more money is left on the table for preceding months. So I'm encouraging everybody to get those submissions in as quickly as possible. And of course, if school districts are having issues, there are child nutrition program specialists within each education service center that can offer technical assistance. They're offering trainings in the computer labs to help people get their documentation ready for submission. And then as always, you can call the Texas Department of Agriculture, and we can also provide technical assistance. So if you have any other questions, please reach out to your child nutrition program specialist in your ESC, or feel free to call TDA.
That's clear.
Hi everyone, my name is Christy Denman and I'm an outreach specialist here at TDA in food nutrition. I hope you're each doing well today. Thank you so much for letting me come and speak with you. Implementing the new nutrition standards has and continues to be a challenge, but using creativity and innovation, Texas school professionals have made great strides towards incorporating these new standards and increasing student acceptance of them. Over the past several months, I've had the unique opportunity to hear about the wonderful work that is happening across the state of Texas in regards to schools maintaining compliance with the new standards, educating various stakeholders on the changes, as well as, more than anything, providing students with a good, nutritious meal. These success stories now have a home on our website on squaremeals.org. In early October, we launched a new page that it was created to showcase the best practices that I was housing, that I was collecting, and we wanted to share them with everyone. It is located on squaremeals.org/best practices, and I'm going to switch over to that view now on the laptop so we can go through that page. How do I switch over that? Thank you. Like I said, the address to this page, if you'd like to get to it quickly, you can type in www.squaremeals.org/best practices. Each of the articles we try to provide as many pictures as possible. We want to mention the district name in the title, list the date the article was published. That's always on the bottom of the article to the left, and link to any provided PDFs, websites, etc. that the schools give to us whenever we are interviewing them for the best practice story. Once the article goes live, I like to send an email to the district contact that I worked alongside in order to publish the story, as well as CC the ESC regional office where the district is located. This page, as you can see, it's getting longer and longer in length. And soon we will begin to archive these stories for the month of October. Let me show you where we're going to archive those. When you enter in on this page, to make it shorter, we'll start to archive here on the right, because we definitely don't want to remove them. We want to make this an available resource that continues to grow with time. And so if people would like to go in and search for recent articles, they can do that. But we want to definitely maintain this page so that it looks clean, and the way we can do that is maybe to highlight 3 to 4 stories on it and then begin to archive on the right over here. I collect these stories from several sources, Every other week, a document goes out to the regional ESC offices. It's called News from the Field. This is a document that we are able to use to collect the challenges that districts are facing as they're implementing these changes, as well as there's a section on there that highlights the success stories, the good things that are happening in our district that a lot of times go unnoticed. They're not seen, and there's so many people that are working really, really hard, and we want to showcase that for the state of Texas. And that's the purpose of this page, is so that we can get those stories up in front of everyone so they can see them and learn. So create a place on our website where we can share ideas and that they're easily transferable from district to district. Visit from school monitors. A lot of times I'll get emails from school monitors who've been out in the field and they've seen something really creative and innovative, and they'll shoot me an email and say, I think this would be a great story to highlight. And so then the wheels are put in motion for me to contact that school nutrition director and begin collecting the story. Sometimes districts will contact me directly. Up at the top of the page, my name is right here on the last line of the first paragraph. So a lot of times people will just email me directly and say, I believe we have a really great story that could be published on your website. And then I will contact them and get the information from them, and we'll start crafting that story. And some of them are my own environmental scans on the website. I'll go out each week just to see, are there any news stories that have captured what schools are doing across the state of Texas. One was for Northside ISD. I'm trying to figure out where we posted that one. It was a news article for them. It was a really great story. And so I found that using an environmental scan on the internet. So if there's two ways in which I need your help. One is I need you to send out this web link to as many people as you can that you feel like would benefit from it, that would find it useful and helpful. And also, if you hear of a story that you feel like that we could possibly post on this page on the website, if you would consider sending that to me, or just the contact person, that's all I really even need, and maybe just a brief description of what it is that we could highlight, and then I will contact them. Again, you can use my name up here in the top paragraph. Just click on that. It'll open up your email browser to email me. Are there any questions at this time about this page on our website?
Oh, that mic's on.
This one?
Yeah, because that goes to the
perfect
webinar. Somebody did ask a question. Somebody did ask a question on where school districts can go to submit their menus for certification and to be reviewed for the additional 6 cents. That is within our database system, TXUMPS. It is where the school districts go to file their claim. And while we're on the website for Square Meals, I'm going to show you that there's on the home page, there is a link that takes them right to TXUMPS. So I'm just going to go back to the home page for squaremeals.org. Eventually, there we go. And if you scroll down to the very bottom, there is a link at the bottom of the page that says Access to TXUMPS. That's the system where they go to submit menus for 6 cent certification.
Are there any other questions? Nothing else on nutrition for Christy and Jackie? Okay, well, thank you, ladies, very much for coming.
Thank you for having
Appreciate
us.
it. All righty. So what questions do all of you have for any of us? We still have Anita here. We still have the ladies here with dating violence. Anybody have any questions?
Yes, this is Region 3 Quera. We have a question for Anita.
All right. We'll bring Anita on up here.
Okay.
All right, I'm here.
Hey, Anita, it's Wanda Hayes and Carol Watson. Our question is, when this new chart comes out, do we start using that this school year, or do we implement that into the next school year? As far as like the temperature changing from 100.4 to 100, and our big thing will be the lice too. Normally when we find live bugs, our policy says they go home. We are not a nip-free. I mean, they come back and we educate parents, and we've been giving them products and working with them. But those will be two of the biggest changes for us. Do we start that as soon as we come back in the new semester?
I would say as soon as I know when the rule becomes effective, I'll send out a notice. And once that rule becomes effective, then that's where you start it. We will definitely be trying to give you some guidance, because we know if your policy is different than what the law says, it's going to take some time to do policy changing, simply because it has to go through the school board. So let me do a little bit more research on exactly how we deal with that head lice situation and the policies that you have in your school district. Definitely, once the rules are adopted and they become final, there's usually a date that they are officially to go into practice. But I do understand the issue you're dealing with when you're dealing with a policy at the district level that may take a few months to change. So let me do some checking into that, and I'll try to get you some more guidance on how to move forward with what is in the rules that's different than what might be in your policy. And I'll send that out at the same time we send out the final rules.
And Anita, I don't want to put you on the spot, but is there a timeline for the policy, the rule changes?
The rule changes probably have been, you had public comment in August, and once the public comment is finished, then they close public comment. They either add to the rules what the comments have been, or they have to write justification as to why they're not accepting that comment or adding that into the rules. And then after that, there's a 20-day period that it's posted, and after that 20-day period, you end up with the final rule adoption. So let me do some checking, and I'll get back with you, and I'll send it out through Kathy so that you all have a better idea of exactly when that kickoff date is. And then we'll talk about how do we work with schools when they have a policy that might be in conflict with what the new rule says. And I'll give you that guidance.
Sounds great. Thank you.
On that same note, Region 1, when all those changes are made and TASB changes those policies, could that be possibly added to the TASB model student handbook that they put out late spring, early summer?
I could certainly work with TASB to see what we could do to coordinate that effort, because I do understand that TASB writes about 99.9% of the policy for most school districts. And so I'll get with TASB to see if there's not some way we can coordinate that effort to where everything is kind of in sync, because I do know it is difficult to get policy changed. And if you can do anything in a collaborative effort to make it all universal, it does make it so much easier on schools. So yes, I'll take that to the TASB folks and see what we can do to help coordinate that effort with them.
Sorry, I have a tickle I can't get rid of. Do you have any other questions for Anita or any of us? Excuse me.
Anita, somebody evidently missed the discussion on the beginning of the lice question. What law changed?
Someone had sent a webinar question that they didn't know that the law had changed. The new rules for communicable disease rules, as well as the communicable disease chart, head lice are no longer an excludable condition. And so once these new rules are put into place, children, who happen to have that nasty little bug, can't be excluded from school. That's what the new rule is going to state. So in an effort to get the policy aligned with what the new rule is, we were just having a conversation about coordinating with TASB as well as giving you all some guidance on what to do in the meantime if your policy is not congruent with what the new rule says.
Other questions?
This one is either for Anita or for the TDA girls. We have been really working with, especially with our 4 and 5-year-old kids, with the peanut aware, and we have an approved snack list where kids are bringing a lot healthier snack choices. But we have a food action group that met after a parent survey where the parents wanted to talk more about making the foods look better and taste better, with the current guidelines. Well, it was brought to my attention that they're wanting us now to start serving peanut butter. And I know that is, we've worked so hard to really make a conscious effort. We have sun butter that we're using that I think tastes good, that the kids like. What are your thoughts on getting peanut butter back in with the current food allergy laws and with the things that we know currently about children and nuts and peanut butter?
I'm going to jump in, and then I'll certainly let Texas Department of Agriculture talk about their recommendations related to this. I know that the food allergy guidelines really want school districts to look at this on an individual basis. Sometimes even individual campuses are going to have a different structure to dealing with food allergies than other campuses within the same district. I do believe this is an issue that individual schools are going to have to look at individual children to determine how to keep children safe when you have foods that potentially could lead to anaphylaxis and a child's death. So I think it's one of those things that you have to balance the needs of all with the safety of a few, but certainly looking at it from an individual basis, looking at it from, and it may even be a classroom decision based on the number of children who might be there that have food allergies. So it's really not a one set of rules guide everything, because every single child has different things that have to be considered when they are in a classroom and have a potentially life-threatening food allergy. So I know that's really not an answer, but I really think you have to go back and you have to look at the individual situation. You have to look at the individual child that may or may not show an anaphylactic reaction with a known food allergy. So that's kind of what I tell you, is it has to be done on an individual basis, and sometimes that individual basis can be classroom to classroom. You want to throw in? I'm gonna let the ag person come up and talk to you too. Okay.
Thank you.
Well, our experts have actually left the building already. I don't really have anything specifically to say, but I can bring it to the attention of our nutrition coordinator to address peanut butter and the allergies and see if we can address it from that standpoint. I'll bring it back to Mary and see what we can do about that.
Thank you very much. Thank you. Any other questions?
Yes, we have a question for Anita.
Anita, you're front and center. She's a popular person today.
I should know better. Just stay in the chair. Just stay there. Yes, ma'am.
Hi, Anita. This is Laura Lynch, Joe Johnson, and Dr. April Fox with the Fort School District. I have a question about the head lice. I understood you to say earlier in the presentation that school districts were at liberty to make more restrictive policy than the state rules that are coming out. And I just want to clarify that because I became a little confused by some of the later conversations.
I think the bottom line is children need to be in school, and that's what we heard loud and clear from those who gave us input on the rules. They did not feel like a child should be excluded from school because they had head lice. We understand that, schools run on children being in attendance, and children learn when they're in school, and certainly we don't want to exclude children. There are going to be circumstances and we're hearing about it a lot, where there is a consistent pattern of children being in school with head lice, which creates problems for other children. So I think much like we spoke about the food allergies, it's going to have to be based on an individual basis. We know that when the head lice were an excludable condition, some schools adopted a no-knit policy. That's probably not an evidence-based policy, but we certainly want to allow some flexibility as school districts deal with consistently infested classrooms, I guess is the best way to put it. In other words, if you have a real issue, there may be action that a school district could take or would need to take in order to make sure that there's not a consistent pattern of children missing school because they've got head lice. Does that make sense?
So it does. I just want a little further clarification. That would mean that we would need to change our policy to where we do not exclude children on a routine basis for head lice or nits.
That is correct. Yes, that's another area where you're. Go ahead.
One of the reasons we've had a policy like that, in addition to our parents being very concerned about other students with head lice, is that we wanted to set a standard of grooming as well as we do with our dress code policy in terms of teaching and guiding our children, our students, what's acceptable in our community and in our workplace as they get older, not just on a medical basis. So we no longer really, that's no longer an option at this point.
Okay, and for those of you who have policy that might be inconsistent, again, this is something I'll take back to the folks at the Department of Health to help come up with some guidance on how to make the transition between what is currently in the policy and how it might be incongruent with what the new rule is going to state. So we'll work on getting some directive and get you some more supporting information so you can make better decisions at the local level.
Right. We don't really see this as a medical issue, but more of a, no, we don't want you coming in house shoes and pajamas, and it's not acceptable, to have bugs in your hair.
Right.
That sort of thing. So I appreciate if you will send us some more information. That would be great, and this has been very helpful.
All right. Thank you.
Next question. Anybody else have any questions, either at the service centers or on the webinar?
This isn't a question, but I just wanted to let you know that Region 6, Bernadette Woods, was in attendance. I missed the roll call.
Okay, thanks.
You're welcome.
Is this the proper time to give you additional insights? I think they're okay. Kathleen.
I'm sorry?
Could you get done with Region 7?
Yes, ma'am.
Is this the time to give you the remote site
Yeah.
additional count?
Sure. You can go ahead and give it to me. I'm going to go ahead and do the roll call for those who weren't here, but I'll take your remote sites now.
1.
Okay. Thank you very much. All right. Well, if there's no other questions, thank you very much, Anita. We'll get you out of the hot seat over there. And that'll leave Barney and I up here. So does anybody have any questions for Barney since he's new to the team? We're glad to have him here, that's for sure. All right, let me go ahead and call those who weren't in attendance at the beginning. Region 2, did you have anyone? Region 4?
Region 4 is here with one remote.
Okay, thank you.
Lockport ISD is with Region 4.
Okay, thank you. 5, 9, 12, 13, Region 14, and 18